3, we did a program on women's pelvic health. I'm Joy Greenhalgh, I was team leader. We have Kaylee Acosta, Anna Olvera, Kylie Christian, Cheryl Moore, Berenjela Delgado, and Raylene Groshans. We are here to present today on our program on women's pelvic health. So this program for pelvic health will be run out of Palmer Hospital and will have a focus on preventative care prepartum, immediate care postpartum, and pediatric services for the newborn infants. Some of the conditions that we will focus on treating are incontinence, leaky bladder, tearing of the labia, pelvic floor pain, cystocele, rectocele, pubis diastasis, urethrocoele, and diastasis recti. The mission for our program is to empower women and help them regain their independence by addressing health needs related to pelvic health that are often overlooked by other healthcare providers. Our vision is to further open the conversation related to women's health and allow women to get the care they deserve to treat pelvic health dysfunction following the birth of their child by treating the whole patient starting before the birth and treating both mother and child following birth.
The population that we're trying to target are women who are considering having children, who are currently pregnant, or just delivered a baby. There's really a specific need for rehabilitation services in this population due to the changes that come along with having a child and the labor process. The childbearing age is anywhere from 11 to 40 years old, and we will also treat children and infants and newborns to see if they will meet their developmental milestones.
So some internal marketing strategies that we want to use within the hospitals, we're going to host lunch and learns. This is when physicians or hospital staff can come in and learn about our program. We'll next send out weekly emails about the new things that are going on in the clinic. This is to help us maintain our referrals and also spread information about us by word of mouth. Some things that we plan to do outside the hospital is we want to begin having flyers being sent out to the local health offices. We also want to update the hospital's website to include our specific program, in which it is going to enable the patients to be able to make appointments and also provide education on what exactly we're about.
So as far as marketing tools, our patient referrals will come primarily from physicians at the hospitals, local OBGYNs, and primary care physicians in the area. And then we're going to use our PR firm provided by the hospital to help establish a positive media message. We're also going to be using word of mouth of the patient's positive experiences, and we're thinking that's going to be the best way to advertise our program. We'll also be speaking at events and at professional conferences. And then we're going to start by advertising by giving presentations to doctors and nurses in the hospital and emphasize the importance of benefits from our services. We're going to have flyers and brochures in the OBGYN lobbies and in the treatment rooms. And then we're going to set up billboards stating our company's vision in the San Diego County area to reach the general public. Informational classes are also going to be free as part of the prepartum care, and then this will allow expecting mothers to get information about the program.
Okay, so for our financial projections, we estimate our startup cost to be approximately $44,000. Our operational costs, once we get the business moving, our fixed operational costs will be about approximately $358,000, and our variable costs will be approximately $10,000. At the end of the first year, we expect our annual revenue to be $666,000, and our total cash at the end of the first year is going to be $265,000. All those numbers bring our net worth for the first year up to $317,000.
Some of our goals for our business in the next 3 years is by the end of the 6 months, we plan to enroll at least 10% of the patients who attended the informational classes on the prepartum care. So we want our classes to not only be informative, but effective in producing or procuring patients for our business and making contacts for future referral sources. This percentage will give us the indication if the time and resources spent for these classes are beneficial to our business. Next, we want to achieve a financial profit of 20% at the end of the first year under the condition that expert services were provided and therapists were paid for their predetermined salary. We want our business to be financially successful and create revenue each year with a healthy cash flow. However, all care must be delivered with excellence and meet our high standard of care, and all of our therapists must be paid what they are owed and satisfied with their jobs.
So other goals include that by the end of the first year, we will achieve a 90% higher approval rating from patients based off of written surveys given at each discharge. Patient satisfaction is important to us. We're creating this business for the good of the patient and because there's a true need for our services. If our patients or clients are not satisfied, we'll do what we need to do and make the changes necessary until they are. And our last goal is that in 3 years, our business growth will expand to 2 rehabilitation managers and 4 physical therapists to increase our productivity, to allow for more patients and increase overall revenue. We want the business growth to allow going from 3 physical therapists to 4 with 2 rehab managers. This will allow for more patients to be seen and increase our revenue to continue to expand the business. And thank you for listening to this presentation and reviewing our final business proposal. This project is very important to us and we hope that you will consider investing.